Hi guys, this is Dr. Nida with Keys of Health. We're dealing with a respiratory disease caused by a novel coronavirus that was first detected in China and which has now been detected in more than 100 locations internationally, including in the United States. The virus has been named SARS-CoV-2 and the disease it causes has been named coronavirus 2019 or COVID-19. It is now a pandemic. A pandemic is a global outbreak of disease. Pandemics happen when a new virus emerges to infect people and can spread between people sustainably. Because there is little to no pre-existing immunity against the new virus, it spreads worldwide. When you have a crisis situation, there's a lot of news, some outright hysterical, claiming we will all perish, and some totally disenfranchised, claiming it's all a hoax. It is best to take a balanced approach and remain level-headed. We don't want to put ourselves in harm's way, neither do we want to go hysterical and be in a state of panic because no good will come out of it. Do what is right for yourself, your family, your neighbors, and your community. This is a time to be a good citizen. Follow the recommendations of the experts. Practice social distancing. This is not the time to live it up. This is the time to live responsibly. Stay at home. This is not a time to take vacations or have large barbecues or pool parties. You can be carrying the virus around and making many people around you very vulnerable. If you have elderly neighbors, check on them, but from a distance. Elderly population is the most vulnerable to catching this disease. Many doctors are recommending not visiting elderly people and recommending self-quarantine for them. This is such a difficult decision because on one side you have their physical health and well-being, and on the other side their mental and emotional state. So please be vigilant of the vulnerable populations around you. Drop off groceries and other essentials at their doorstep. Call and check on them and give out your number to your neighbors in case they need you. I have heard some businesses who have made exclusive hours for elderly population. This is a good initiative and will limit their exposure to the virus to a certain extent. Maybe you can suggest your local supermarkets, banks, and other businesses to do the same. If you are sick, don't visit others. And as much as I hate to say it, don't visit sick people. Check on them over the phone, through text messaging, through social media, but don't go to them in person. So let me talk to you at this point about face masks. Do you need to wear a face mask? This is a very important issue because there's a global shortage of masks, even in the hospitals. A dear friend of mine who works at a hospital in the US, and at the moment, they have only a handful of masks for a whole week for a lab full of technicians. This is deeply concerning. It is the healthcare workers dealing with COVID patients who need masks the most. If you are likely to be in close contact with someone infected, a mask cuts the chances of the disease being passed on. If you are showing symptoms of coronavirus or have been diagnosed, wearing a mask can also protect others. So masks are crucial for health and social care workers looking after patients, and are also recommended for family members who need to care for someone who is ill, ideally both the patient and the carer. If you're going to be in a crowded place, then it makes sense to wear a mask. If you're taking someone to the hospital or a clinic, then wear a mask. However, masks will probably make little difference if you're just walking around town or taking a bus or going grocery shopping. And you don't need to wear it at home at all. So there is no need to bulk buy a huge supply. Avoid unnecessary handshaking. Social distancing is highly recommended by experts at this point. Maintain a 6 feet distance between you and the other person when you're out in public. Wash your hands with soap for 20 seconds minimum. Don't touch your face. Cough into a tissue or your elbow or your sleeve. And rinse your nose. That's an advice you may not hear from many people, but it makes a difference in protecting you from germs in general. Another thing I would recommend is gargling with warm water mixed with salt and vinegar. I'm not touting this as a remedy to coronavirus. It's not a remedy against coronavirus. It is generally a good defense against germs and extra protection for you in general. I have been sharing a lot of teas, herbs, and foods with you that can help you boost your immune system, which is what you need at a time like this. Incorporate them in your daily routine as much as you can. Stay safe, be responsible, take care of each other. I will be back with another video soon. Meanwhile, please like and share the video and subscribe to my channel. Take care. Bye-bye.